Greetings, all attendees. I'm Amin Mohammadi. This is the third series of a National Online Nursing Informatics short course. I'm so thankful that you joined us in today's session. It is an international course, and we have lots of participants from different countries with different time zones. So good morning, good evening, good night to all of you. This series of our short course is entitled Technology Solutions for Telenursing and Generating Knowledge. It will take you 2 months to get it completed. You will have a month of synchronous lectures with 4 sessions and approximately a month of asynchronous program. Today, it is the 3rd session. Recorded sessions and slides will be available on the program website. Therefore, you are able to review again. If you have any question during the lecture, you simply can write it down and chat in the chat box, and surely our team will help you with that. Before getting started, let me sincerely appreciate Professor Tony Hepta, Professor Carolyn Sipes, and Dr. Mallory Rose, the distinguished experts in the field of nursing informatics from the USA, for making the time to present us their fantastic lectures. I also want to thank the director of this program, Dr. Khatara Seilani, Associate Professor of Critical Care and Nursing Management Department, and the moderator, Dr. Asieh Darvish, Lecturer of Medical Surgical Nursing Department. Thanks to all colleagues who have done a lot for making this meeting happen. Please notice that this course has a survey at the end, and any participant should do it to be granted the certificate. And also take the pre-test and post-test serious if you're willing to get a certificate. Today's program will end 15 minutes before 8 p.m. for Tehran time. First, we have poll. Second, we have Professor Sipes' lecture for 45 minutes. Then question and answer for this lecture. Then we have Dr. Darvish, 13 minutes, and question and answers. At the end, we have the poll. But before taking the pre-test, we have Dr. R.P. Manukyan, Associate Professor, Vice Dean of International Affairs at School of Nursing Midwifery at Tehran University of Medical Sciences. Hello, Dr. Manukyan. How are you?
Excuse me. Yes, we have Dr. Manukyan. Welcome, Dr. Manukyan.
Nice to see you again.
Thank you. Do you have my voice? Is it clear?
Yes, clearly.
Okay, thank you.
Thank you.
Hi, everyone. I'm R.P. Manukyan. I'm so delighted to welcome you to this 3rd session of Technology Solutions for Telenursing and Generating Knowledge online program. First of all, I'd like to express my special gratitude to our esteemed professor, Dr. Sipes, whom we are honored to have with us today. Also, I highly appreciate the efforts of our other international colleagues, Professor Hepta, Professor Rose. We are so thankful then. My last but not least thanks goes to my Iranian colleagues. My special thanks to Dr. Darvish for her brilliant work and efforts to design the Telenursing informatics. Also, my other colleagues, Dr. Sayadi, Dr. Seilani, Dr. Azadi, and a Praise to Race team, and also our talented students who accompanied us. Thank you for joining us, and hope this session would be useful and informative for you. I wish you will enjoy it. Thank you very much.
Thank you very much, Dr. R.P. Manukyan. Now, dear participants, kindly answer the poll questions, which we will launch on your screens. The poll is launched.
Whoa, that's fast.
%22% have participated in the pretest, so we are willing to see others joining us. Thank you. %40. I appreciate your participation. The latest list of the countries participated in this program is Iran, Iraq, Ghana, Nigeria, Turkey, UAE, UK, USA, Palestine, India, Germany, Italy, Poland, Afghanistan, Singapore, Indonesia, Georgia, Morocco, Qatar, Canada, Sri Lanka, Pakistan, England, Egypt, Brazil, Philippines, Lithuania.
Wow.
Thank you all.
Uh-oh.
I think some participants have a sort of problem with pretest. Mm, Okay. Now, please welcome Professor Carolyn Sipes. Professor Carolyn Sipes has more than 35 years of clinical research and research, academic, and informatics experience. She is certified as an advanced nurse executive and informatics nursing specialist by the American Nurse Credentialing Center. She has published the project management for advanced practice nurses, application of nursing informatics competencies, skills, decision-making texts, as well as numerous other peer-reviewed publications, books, and book chapters, and presented both nationally and internationally. And we could say, if the knowledge is power, she is one of the most powerful women in nursing informatics.
Well, thank you. That was prophetic. I'm not sure.
We'll start the lecture after the poll is ended. I think it's shared again. Okay. The results are shared, so.
I think poll is end.
Yes. Professor Sipes, please take it from here. We're all eyes and ears.
Oh, great. Okay. Let me start this. Okay. Well, welcome everyone to this part 2 of telehealth and telenursing. Can everyone hear me?
Yes.
Yes.
Okay, great. Can you see the slides? Another
Yes.
big question. Yes. Okay, great. With that, I'd like to review the agenda, which is today we're going to be summarizing the current status of telehealth nursing with some definitions, the applications, and looking at some of the current trends. And just to put this in perspective, the information here is primarily what we're doing in the United States currently, looking at telenursing. We're going to be discussing the impact of the pandemic on telenursing, and especially looking at education, which is a big need. We need to figure out how to provide this education to move forward for nurses. We're going to be identifying informatics competencies that are required to deliver the telenursing. We're going to be looking at patient outcomes, as they currently are here in the United States. We're going to be looking at current exemplars of telenursing. And then again, we have the self-assessment quiz at the end. So with that, first, I think it's really important to understand the differences in all of the tele-type programs that are out there. There's telepharmacy, telebiogenetics. There is a tele for just about anything now. So telemedicine, though, is a very important definition because it's not the same as telenursing. Telemedicine is the diagnosis and treatment of health conditions in a remote location, part of telehealth, which is the overall umbrella of telenursing. And within telemedicine, here in the United States, only physicians and nurse practitioners can perform it. The telemedicine, which includes education, monitoring, and triage from a remote location. Then telenursing, which is again different, is where nurses are more involved. This is where nurses provide distance nursing care while they're monitoring patients, providing education such as how to take your medications, follow-up, remote data collection, interventions, certainly pain management, family support, and multidisciplinary care in a very innovative way, however they can support patients. And this goes a lot to the way we used to do home care. I was a director of home care many, many years ago in Chicago, and would go out and interact face-to-face with patients, and providing most of these type of functions. What is the impact of the pandemic? How has that changed? I think, yeah, there. How has the pandemic really influenced what we're doing and moved telenursing forward? Telenursing is a cost-effective method that reduces treatment costs. You think of the patients having to travel to see physicians, providers face-to-face, and go in for different treatments, come in and see me. I need to go over your medications, when it could be done via virtually via telenursing. Telenursing, again, really compensates and supports the hospital bed and the nursing staff shortage, which we're seeing tremendous shortages here in the US. It reduces patient anxiety and quarantine. The last presentation I did, I presented some data on how patients felt much more comfortable with the telenursing and the virtual interactions than actually the face-to-face interactions. And it's also sometimes we refer to as the white coat anxiety, where their blood pressures would jump up because of just the actual face-to-face interaction with the provider. Telenursing keeps patients at home, certainly to avoid infecting others, which is a huge advantage during the pandemic. And telenursing reduces the risk of the nursing staff infection. And I'll go over this a little bit in a minute, looking at some of the issues, because again, within the nursing realm, we have lost nurses who became infected with COVID themselves. So some of the applications of telenursing, looking at the digital functionality, what can you do within telenursing? Certainly you can monitor activities through a variety of different devices, sending data to a certain computer area where nurses are monitoring it. You can make diagnostic evaluations, especially when a patient inputs their vital signs, that you can, again, record within a digital device. It's great for decision support systems. Certainly storage and disseminating of the EHRs for the diagnostic purposes. You can look at image compression, and I covered this last time, looking at the 3 different ways of the telenursing and the virtual data can be collected, live, remote, that type of thing, looking at x-rays and lab results, other data like that. You can look at and order e-prescriptions, and certainly education of healthcare professionals and consumers is a big area of functionality that it provides for patients. And then certainly support for caregivers. And I'll go into that a little bit, looking at some of the simulation that is available. It also provides support for caregivers, not only nursing and nursing students. So what are some other current status and upcoming trends? For now, there's an increased demand in care during the pandemic. So I think something to consider is, where will we be post-pandemic? except that they're saying it's now going to be going on and enduring for quite a while, that it won't really go away. But what is the demand going to be as the COVID infections rise and fall? Is this going to change? Are we going to continue to have the funding we need to support this? Other current trends are certainly looking at the retiring nurse educators. That means there will be a falling number of nurse faculty. And that's what we're seeing in academia. A number of nurses retiring and no one to come in and follow them and move forward as a new nurse educator. And another thing I just want to point out, some of these terms that are underlined is something that you can take and post into. These can be, these were links that I pulled data from and information, current information. You can put this essentially into a URL and Google, and it'll bring up a lot of very important and new information to keep you updated if that's what you're very interested in exploring. Another big area is nurse burnout from the pandemic, and I think we've heard that worldwide, that nurses are just exhausted from working the many, many long hours and days without a break because, again, the shortage, or other nurses that have become sick because they also became infected. So again, nurse burnout is underlined. That is another key term, key words that you could post in, put in the URL for Google. And again, there's a tremendous amount of new information out there about the nurse burnout from the pandemic. Other issues are the aging population is becoming more complex. There are more comorbid conditions, multiple diagnoses that are much more difficult to diagnose and treat. Nursing staff is reaching, again, retirement. That goes to the not only the nurse educators who are retiring, is that the nursing staff typically is getting older. And again, there's a lack of new nurses coming in and wanting to be educated as a nurse. So we're having issues there. And another trend is the greater shortage in the rural areas. There are, especially here in Colorado and Western US, the areas that are few and far between, and I used examples last time of Montana and Wyoming, where it may be 500 miles between another medical center and somewhere a clinic where patients can go and receive treatment. So again, in our rural areas, this is the big issue. And another important piece of data that I found I thought was really interesting, again, is there has been 154% increase in telehealth visits since March 2020, with the advent of the pandemic, had a huge influence on that. Some other current trends and upcoming trends. I thought this was really interesting to see that our Congress is moving forward and being very proactive, especially with regard to telehealth, telemedicine, telenursing, telepharmacy, all of the different modalities for providing healthcare. And our Congress has come up with what's called the Choose Home Care Act that is currently in Congress being considered to become an act, a policy moving forward. And what this would do would expand the benefits provided by our Medicare for home health services, which has been in decline pre-pandemic, but now is really, as you saw, increased tremendously. It would provide for more remote monitoring, and this would be especially important and critical in the comorbid conditions where patients can't travel very easily, and with access again to care, medical care. And with this act, the provision is that seniors could choose telehealth nursing services for seniors. And with this, they would go to a home rather than a skilled nursing facility after hospitalization if this act passes. And again, the telehealth nursing is underlined here because that's where I was able to go and find this most recent information. So I think this is a very interesting notion moving forward, that moving patients back to the home where they would much rather be, certainly, than move to a skilled nursing facility. The other impacts of the pandemic on telenursing, some of the new developments are certainly education of healthcare consumers and professionals. That's not necessarily new, because we have been doing that. It's just increased dramatically since the pandemic. There is a higher quality of care, and it removes many of the geographic barriers to care, as I mentioned, with a lot of the remote sections of the United States, where it's very difficult for patients to receive care. They have to travel many miles, or the Montana example I use, that sometimes if there's a critical incident, the nurses have to fly out in a helicopter to support, retrieve the patients, bring them in. And I'm getting a message here, excuse me, popped up on the screen. And now, there, back to this. The other new developments, again, lowering the cost of healthcare, improving the quality of the health record. So these are some of the new developments. Certainly, again, continuing care, centralizing health records. This is something that IT and vendors are looking at, centralizing health records so that you can access. And again, this is because of some of our other regulatory requirements where you cannot block data. There's a big issue about blocking data, and I did cover that, in the last lecture. Incorporation of the healthcare consumer as an active member of the healthcare team, collaboration with other healthcare professionals, and then improving decision-making. Back to this collaboration with healthcare professionals, again, that goes to that regulatory requirement we have here that healthcare professionals cannot be found blocking patient data from moving to different organizations that need it. And again, if that happens and they're found to be blocking data, that you can be fined up to $1 million. So that is an issue where it is helping to open this up, and IT and the different vendors and the different professionals are having to share data more than maybe they would have in the past. So some other things that we need to look at, and especially going back to the nurses who are the burnout issues with nurses leaving, moving to different, quitting jobs and moving to other temporary type of jobs, is resilience. And you'll see this more and more, that the employers here are looking to define what they can do to help nurses deal with burnout. And one of these is the big topics now that you'll see in our literature is looking at nurse resilience. What can we do? Like provide time off, break rooms. I have a couple of doctoral students that are doing studies looking at relaxation oasis for nurses on the floor, someplace they could go and just sit and relax and, you know, have a variety of different relaxation methodologies there that they can use. So looking at that, and then following up with the data, looking at, you know, did this type of thing really help with burnout and different nurses, you know, moving on or quitting or, you know, finding different things to do. So resilience is a big topic here in the United States, especially within, you know, nursing and education, and encouraging our employers to look at these type of things and not just, you know, keep doing the same thing, because again, you know, requiring nurses to work, you know, the five days, 12-hour shifts, that type of thing. It's looking at being more flexible in staffing is part of resilience, supporting resilience in nurses. So experts are promoting, again, this now because of the burnout. Nurses are, especially, it's been known, and there's a lot of research that nurses are especially prone to stress related to illness and burnout. And the key to recovering, and that employers are supporting more and more, is helping nurses to recuperate very quickly, because the risk of the negative consequences of the ongoing stress of COVID, it's months and months and months and days of working overtime, and really impacting burnout and nurses leaving. So there are programs designed to help students practice nursing skills. This is another thing that is really big, like clinical decision making, while exposing them to the diverse patient populations, and that's the simulation, which I think is really a great idea, not only for new nurses learning the different skills, but for nurses wanting to go back and practice different types of scenarios of patient populations, and feeling better about it. So for example, we have the nursing simulation platforms that, again, reinforce lessons. You know, if the nurses have a question about, oh, here's a new patient with a new diagnosis I've never seen before, I'm not sure what to do, they have the ability to go and practice, to reinforce, this is how you care for this patient. And it's the high fidelity simulators, not just the models that are laying in a bed and then don't really have interaction capability, you know, the different, you know, crashing, you know, an emergency type thing, codes, that kind of thing, is what the high fidelity simulators are really important and really critical to have in a lot of the different areas, the more intense areas where there's, you know, nurses are assuming a higher level of care, a critical care, you know, again, the patients who have the chronic diseases and the, you know, the multiple comorbid diseases. So this is an example of one of these. It's called vSim, and you can look that up, you know, Google that, and there are interactive modules here that you could go in and practice with, even on the computer, just, you know, looking at what this type of a program is. They've also added a new modality, is looking at the mental health and the psych nursing simulators. This is something new that they've recently put together. And this is an interactive, personalized simulator that experiences and has an evidence-based background, experiences different psych patient scenarios. So these are really helpful, one way to really help our nurses move forward with this. Another impact, again, is we're looking at, in academia, we're looking at how COVID has really changed how education is delivered. And I think if you remember back to like March 2020, it was immediate that we had to move from online and face-to-face to virtual. And many organizations, universities, healthcare organizations had to get these programs up and running very quickly, within a week. We at our university, it's an international online university. So we were already essentially set up and started having to handle a huge influx of students coming in to continue education virtually. So this increased during the pandemic, as I'm sure you're all aware. The nursing colleges used the online classes. Those really geared up during the pandemic. The trends, we're wondering, and something to consider, will these trends continue after the pandemic? So with the online classes, certainly we will, because we're an international online university. But you wonder about other universities that have brick and mortar, where the requirement is to be on the face-to-face. Within that, the online learning, they're beginning to find that within that online learning, there's been an increased retention of the information, and there is data analysis. This is another underlined terminology that you could Google, and it found within the data that it takes less time to learn, and it potentially lowers, certainly it lowers overhead for the colleges. So just some asides from the advantages of what COVID has done. And again, a big consideration is the impact of the pandemic on our education. What are we going to do to continue and really stay up to date and be challenged as we move forward? How do we provide the best education for nurses? And there are many other national organizations, like the National League of Nursing is working with companies such as the one for VSIM to work to integrate and provide ongoing programs. Another interesting trend during the, since the pandemic, is the travel nursing, and has increased tremendously. And again, this goes to nurses wanting to find something different. They're burned out. They want, to travel someplace else and see if it's different, how it's different, practice in a different modality. So again, travel nursing has really increased. So again, within our concerns as academic, looking at how we can best provide education. And we're doing this, the virtual classrooms, the virtual clinical experiences. When COVID essentially shut down many of the sites, it also shut down the practicum experiences that nurses were permitted, encouraged to be involved in, to continue, the graduation and get their experiences. So within that, then we had to move to virtual clinical experiences and get really creative about how we're going to continue to educate our nurses. One of the things that other impacts on education are the AACN nurses. The data is coming out that most of the employers now, and this was an interesting mandate earlier, is that most of our employers prefer that nurses have their BSN, at least the bachelor's degree, for nurses as an entry into practice. And within our organizations here, the American, for example, the American Association of Colleges of Nursing have kept increasing the bar for better education, more educations and skills. And they've found that within this, it helps improve patient outcomes. Some of the competencies that, and there are many different versions of and philosophies about what the companies should actually be for ability to practice within telehealth nursing. And these are 6 areas that some of the different organizations have said are mandatory to be able to even practice telehealth nursing. And they need to have an informatics background, certainly computer science within telehealth nursing, data protection, understanding data protection and security, certainly documentation online, information and communication systems, and telemedics and e-health. So these are some of the basic courses that are being suggested and recommended in order to practice telenursing at a basic level. So again, I had shared this last time. This was a study that was done in the Netherlands, and they identified 52 skills that were needed in order to practice telenursing competently. And one of the key things that they found is that clinical and procedural knowledge is critical, is the very basic skill needed to even start practicing as a telenurse. And this is to understand what to do in case of emergency. These were the basic criteria that they identified in this study. And again, there are, if you look for nursing informatics competencies, telenurse competencies online, you will find a number of different organizations that have different, consider other skills to be more important than some others. And this was, again, the example from the research done with a group in the Netherlands, identifying these 14 areas, but then within these 14 areas, they identified additional competencies. For example, training patients in the use of technology. Within that, it defined that to be able to even do this, train patients, you need to have the basic computer skills yourself and be competent in computer literacy to even be able to train patients. So within these, again, there were 52 competencies identified. And within our group, within Adtalem, Chamberlain and Chamberlain University, Dr. Hebda and others within a research group identified nursing informatics competencies years ago and have worked to really develop those. And there are several tools that the group developed, and it's called the NICA Nursing Informatics Competency Assessment tool, with a number of different competencies identified through a number of research organizations. So within that, moving on to what is the role of looking at usability and ease of access. The other thing is, with the ability to be computer literate and competent, other things to look at are how easy is it for the users to be able to access the digital, the computers, and how friendly is it? Is it easy to use the different devices, or if they're very difficult to use, and you have connectivity issues, interface issues, that type of thing, people are not going to be very willing to use this information. So, or use the devices. So within this, using integrating telehealth within an EHR is critical. And again, this goes back to the regulatory requirements of sharing data. So within this, when it's trusted, when usability, the computers, the devices are trusted by the patients and providers, it's much easier to provide integrated information back and forth. Providers will use the devices. So when they, for example, the integration is critical that we're talking about. And when providers take notes with a telehealth visit, telenursing visit, the information should easily flow to other devices, for example, lab results, vital signs, that type of thing. So should easily flow. And that is a requirement within our regulatory organizations in looking at and preventing data blocking and lack of sharing information back and forth. So some other exemplars of practice that's critical to data flow are these, and I mentioned some of these secure platforms last time. They have to be HIPAA secure. And this is a number of some of the video applications that are provided to patients in home care that have already been identified as HIPAA compliant. There are others that will not be as secure, but this is the current list. There are others that are being evaluated to look at security if patients want to use those. So certainly Zoom is one of the secure platforms that data can be transferred back and forth securely. WhatsApp, I noticed last time there were a number of people, participants on this in this lecture that use WhatsApp. So again, it's different within the different countries of what's available and how many of these different applications are available for patients, you know, for all kinds of work that we do. So within that, certainly looking at the integration, which is another really big issue that we keep looking at. And providers are looking to implement a telehealth system that should look for those platforms that integrate with their current EHR system. Sometimes organizations go off and try to develop their own legacy system, and the issue is that it might not interface. The data might not flow back and forth as it should. And again, this is something where our organizations mandate and the government, we have national requirements that they must be certified first before they can be considered an integrated system. And it's not just something that maybe one healthcare organization will develop as a legacy system and then it doesn't interface. So that would be essentially a violation of our Cures Act. So other information is, and this was one of the first questions in the polling, what is the difference in the synchronous visits and asynchronous? And again, in the introduction, you were notified too that there are, within this course even, there are synchronous and asynchronous different methodologies used to be able to continue and complete the course. And for asynchronous, you know, we've gone through this. It's where providers can access vital signs, for example, that a patient recorded before their visit, and can be, you know, updated and have a very important visit and feedback because they already have the data. So one of the other things that we look at, and again, I mentioned the last time, is our Office of the National Coordinator really has support and putting forward rules and regulations for how data should flow and how it should be integrated, how it should be interoperable back and forth. That means that it must be integrated and automatic and not manual, you know, that you have to go in and search manually for the different data components. So some of the these are the last slides. I wanted to put together some web resources available. And since these slides will be available to you, these are different areas you can go and look for additional information. Looking at scope and practice for professionals in telenursing, looking at the standards of practice. And these are typically, as I did the research, these are typically the ones that are under ambulatory care. There was originally a separate telenursing organization, but it's moved under our ambulatory care umbrella at this point in time. So there's tele education, there's a special interest group, a SIG group, other resources looking at the future of nursing 2020 to 2030 is really interesting document to read. And then the telehealth nursing services for seniors, that's the new regulation that is coming forward where seniors can be sent home with a telenurse versus going to a nursing facility. This is another really important resource is the Harris poll. And they have new information out every week on the latest and the greatest of what's coming up and what's happening. So with that, this is the self-assessment questions. You already had this one, you know, with synchronous telehealth. What does it mean? True or false? I can go through all of these. And how do you want to do these, Dr. Darvish? Just some of the self-assessment questions.
Will you please repeat?
How do you want to do these? I'll just go through and read these because you also have the polling at the end. And this was one of the questions. What is the definition of synchronous telehealth?
Yes, no problem. If you like to review the questions, it's okay.
Okay.
It depends on your opinion.
Okay, because I know that there's the polling afterwards too. So, it's important to understand the difference between synchronous and asynchronous. Looking at different alternative means to help students and even nurses, current practicing nurses, develop skills, and using simulation platform is one way that we use in academia. Looking at integration, which is a key component to telenursing and online nursing. Anything that we're doing is looking at EHRs are integrated. That's a critical thing within a system. So here are the different questions. Need to enter with an integrated system. Do you need to enter the same information several times? The answer to that should be no. And the other two are correct. Information automatically goes. That's the key for integration. And it reduces chances of making errors. This question, the ONC, that's that slide about regarding the office of our national coordinator, and the requirements here in the US is that you must have automatic access to clinical information when treating a patient. And the question is, users must be able to find, use information when sending only, not receiving, and that's false because it has to be both ways. not only sending data, but receiving it. And we have the HIPAA secure platforms used. I went over those, and these are all listed as HIPAA secure platforms. And then the last one is just a reflection question. Where will telehealth, from your perspective, be utilized in the next 3 to 6 months? And then the last slides I have are just the references. Okay.
Thank you, Dr. Sipes. Now it's time for question and answer around Professor Sipes' lecture. If you are interested to speak, please raise your hand. Otherwise, write your question in the chat box. If there is any question, we're at your service, dear participants. I repeat it another time. If you are interested to speak, you can raise your hand and we'll activate your voice and camera. Or otherwise, you can write your question in the chat box.
They do answer the questions.
Do I need to re-show the questions?
Yeah, you can.
There's one.
Mr. Mohammed, can you read the question for Professor Sipes?
Yes.
There is a question in the
yes.
chat box.
How will the changes in the telehealth waivers impact care?
Okay, you should read it again and mention the Sipes.
Dr. Lisa Lucas says, how will the changes in the telehealth waivers impact care?
How will the waivers impact care?
Yes, how will the changes in the telehealth waivers impact care?
It would improve care because our Congress, for example, with the one using telenursing versus sending patients to skilled care would improve and move more patients out of the skilled nursing facilities after hospitalization to telenursing and home care. So it would improve. And again, I listed a number of benefits and advantages that patients have identified for wanting to use it. They are feeling safer. They're feeling more confident and secure in having somebody virtually visit, but rather than them having to go out and complete a face-to-face visit with a provider.
Thank you. Olamoyagon Kehinde, I think, says, please, I need future explanation on application of telenursing to travel nursing. Thank you, Professor, for the presentation.
The comparison to travel nurses versus telenursing, was that the question? Just to clarify.
I think he or she says, I need future explanation on application of telenursing to travel nursing.
Okay, telenursing is virtual and the patient stays in the home and uses some device. The travel nursing are where nurses go to different, they travel to different organizations. For example, if a nurse lives in Texas, but then she wants to go to New York, we have contracts here within our organizations for like a 3-month contract for that nurse, to pay that nurse to come to New York and work there for 3 months, because it was critical. You know, they were losing nurses, there were staff shortages. So this is how many of the organizations are filling the staff shortages all over the country, is they will hire nurses who want to come from other states.
And again, Olamayagan Kahinda asks, how can we improve acceptance of telenursing among nurses?
Among nurses, it's yeah, it's essentially higher acceptance of telenursing. I think it's education. This is what we're really working on. And you know, I pointed out a number of ways within the education, the education component of this, of what we need to do within our organization. Walden University and at Telem and Chamberlain, we're already online, so it's similar. We're already using online. We're already using virtual classrooms. We're already using Zoom for many of our meetings, and that's essentially what you do in telenursing. The difference is you have a patient on the other on the computer on the other end, and you're talking to them. It's very similar to our different applications. So within our organization and within our online universities, it's not really an issue. It's accepted as a norm.
Dear participants, if there is any other question, where to service?
Yes, there is in the chat box.
Continuity
provide of care, data collection, decrease cost and reduce
there's an
mortality.
explanation.
That's
yes.
answer. Yes.
Yes, that's an answer.
Yes, for instance, okay. These are answers. Yes.
Okay, thanks to Dr. Sipes and our dear participants. Please stay with us. And now we have Dr. Asieh Darvish, lecturer at School of Nursing and Midwifery, Tehran University of Medical Sciences, Tehran, Iran, head of Nursing Informatics Virtual Department, Virtual University of Medical Sciences, PhD of Nursing and Technology Management, MSc of Information Technology, Management Medicine, BSc of Nursing. Hello, Dr. Darvish, virtual service.
Hello and good afternoon and good morning, and here my slide. Okay. Oh no, that's Professor Sipes' slide. Sorry, I should again share. Okay.
And I have to say special thanks to Dr. Sipes for her wonderful presentation. I was really captivated in his presentation, and I was really
okay. First of all, I want to wish you all a beautiful, and to those of Ramadan. My voice?
Yes.
Okay, so first I want to wish you all a beautiful.
But we don't have your slides.
Okay, just let me, I will start. Okay. I will start again. Okay, I will share it again. Okay, I didn't start. Okay, let me only 2 minutes. My name is Asieh Darvish. I have a PhD in Information Technology Assessment Management with a background in nursing education and professional practice in hospital. And I have been teaching informatics nursing courses for undergraduate, graduate, and doctoral students for about 20 years for our Iranian and foreign students. I published and authored 4 books in Persian for university students in this field. I have also published many national and international articles in this field and done research projects. I'm the moderator of this short-term course and a member of the Department of Medical Surgical Nursing, School of Nursing and Midwifery, Tehran University of Medical Sciences. I hope my accent doesn't make it difficult for some of you to understand what I am saying. I apologize in advance. And I try not to talk fast. I'm sorry. Yeah, I lost my camera, just 1 minute. Okay. And it's my honor, and I'm very happy to have the opportunity to meet with all of you from around 30 countries around the world and talk about my favorite topic, nursing informatics, and this course as telenursing topic. I believe that telenursing is a lever to actually promoting nursing services and promoting people's health, and also leads to a more specialized nursing profession. As you know, these short courses are part of TUMS nursing informatics curriculum for international graduate students. So please take it serious to do participate in pre-test, post-test, and sessions, and also amount of asynchronous program, and participate in the survey at the end. I want to express my special thanks and regards to excellent presentations of the distinguished professors who accepted our invitation from USA. Thanks for their scientific efforts and invaluable published books and articles, which have inspired me a lot. Professor Hedda, Dr. Rose, and Professor Sipes in last sessions had an overview of related health prerequisites for developing a connected health system, the role of support technologies and professional communication and organizations in developing a connected health system, and also competencies for telenursing, the meaning and telenursing during COVID-19, and so on. I'm very thankful to for sharing their valuable knowledge and time. From here, please let me turn off my camera, my webcam, so that the internet speed doesn't interfere. Okay, I should again just stop and let me now start my presentation.
I intend to have an overview of some examples of telenursing services from the articles published and the experiences of telenursing in the world, and review the results and the reasons mentioned by nurses and clients for choosing telenursing. As you know, tele is a prefix meaning at a distance. I would like to emphasize on this sentence that telenursing is the use of information technology to deliver nursing care and conduct nursing practice remotely. So nurses engaged in telenursing practice continue to assess, plan, intervene, and evaluate the outcomes of nursing care, but they do so using technologies such as the internet, computers, telephones, digital assessment tools, and telemonitoring equipment. So nurses engaged in telenursing using telehealth tools, as Professor Sipes mentioned in last session. My objectives included reviewing some. Okay, I'm sorry. I think I received some messages that there is a very low quality. So let me continue with my sharing my slide. Okay, just give me 2 minutes. Okay. I'm sorry for this problem. Okay. Actually, I intend to have an overview of some examples of telenursing services from the excuse me. I intend to have an overview of some examples of telenursing services from the articles published and the experiences of telenursing in the world. As you know, tele is a prefix meaning at a distance. I would like to emphasize on this sentence that telenursing is the use of information technology to deliver nursing care and conduct nursing practice remotely. So nurses engaged in telenursing practice continue to assess, plan, intervene, and evaluate the outcomes of nursing care, but they do so using technologies such as the internet, computers, telephones, digital assessment tools, and telemonitoring equipments. So, nurses engaged in telenursing using telehealth tools, as Professor Sipes mentioned in last session. My objectives, as I said, included reviewing some examples of implemented telenursing cases and the outcomes,
with emphasis on question that why nurses and healthcare clients choose telenursing. So with that, we want to see the articles published in the world first. By doing this, it is possible to imagine which countries are ahead and have more experiences in the field of telenursing. Please note that the number of articles in this slide is few, and it is really much more than this number. And here we see only the number of articles in which the keyword telenursing is used and published in Web of Science. So look at the results. Among the 10 most active countries, the first place is occupied by the United States, then Sweden, and the third place is taken by Iran, my country, and then Brazil, Australia, Canada, England, Japan, China, and South Korea. The United States has the oldest and most telenursing activities. So the United States is the first. Iran has grown significantly in the last 10 years, and in the days of COVID-19, telephone and online nursing counseling has become very active. In fact, COVID-19, as our lecturers also mentioned, highlighted the importance of telenursing services around the world. In general, a brief look at the articles shows that practical activities in various fields have been carried out with different purposes. For example, elderly education. Okay, I am in this slide now. Elderly education services, management of chronic diseases such as diabetes, hypertension, etc., recovery after bypass surgery, phone tracking, women's health, and many other telenursing services. Now, let's look at the results of an international telenursing survey. Here, we can see through telenursing, a nurse can provide monitoring, education, follow-up, remote data collection, remote interventions, pain management, family support, and multidisciplinary care in an innovative fashion. In this survey, over 2,000 online invitations were sent internationally to those in key telehealth organizations and key nursing groups, as well as individual points of contact. Professional organizations that were instrumental in distributing the survey included the Canadian Society for Telehealth, the International Council of Nurses, or ICN, American Nurses Association, or ANA, American Telemedicine Association, or ATA, Association of Telehealth Service Providers, or ATSP, the National Association for Home Care, NAHC, the Capital Area Roundtable on Informatics in Nursing, or CARIN, the American Medical Informatics Association, or EMEA, the International Medical Informatics Association, or EMEA, and the American Association of Ambulatory Care Nursing, or AAACN, and multiple telehealth and informatics listservs. 75% of telenurses believe that certification in telenursing is important and would be interested in achieving certification. This study provides important information about the characteristics of telenurses, the satisfaction of telenurses with their current telenursing role, the specific knowledge and the skills used by telenurses, the settings in which knowledge, skills, and competencies were developed, and their opinion on education in telehealth, and also their perception and the demand for telenurses worldwide. The telenurses most likely received on-the-job training in telehealth to achieve her expertise. Nurses were highly satisfied with telenursing based on assessments of factors such as autonomy, interaction, professional status, pay, task requirements, and organizational policies. Survey respondents believe that currently the demand for telenurses is moderate. However, a sharp increase in the demand is expected within 3 years. This has done, as you see, on 2004 to 2005, and it is published on 2007. Here you can see the results about where the telenurses works in. In this study, the highest number of telenurses were from a hospital setting. After that, from college, and then community, call center, government, clinic, and military. Now, in this slide, you can see what were the types of problem or patients' diseases or telenursing for this telenursing clients. If you can't hear me, please let me know, okay?
Yes, Dr. Darvish, it's clear.
Okay, thank you so much. The most one was chronic care, then medical surgical with 14%, and pediatrics 11%, coronary, psychiatry, obstetrics, neurology, orthopedics, newborn rehabilitation, and the small part were other problems. In this study, we tried to review the experience of telenurses, okay? But I chose another study which concentrates on the experience of patients who actually used counseling on the internet. Now, let's look at the perspective of patients who refer to telehealth services and see what was the reason for choosing these services. I selected this article in my presentation to review the amazing results with you. Participants mentioned some reasons as major reasons for choosing telehealth services and to consult previously unknown doctors on the internet. Participants indicated convenience with 52% they chose, and anonymity with 36%, as you see in the slide. Doctors too busy. That's amazing. Sometimes it happens. Difficult to find time to visit a doctor, 16%. Difficulty to get an appointment, 13%. Feeling uncomfortable when seeing a doctor. This is a very important point I saw in some other articles also. It was about people who cannot talk about their sensitive questions face to face. And the next one was not being able to afford a doctor's visit. It was rare, and a few respondents. These were the answers for quantitative part of research. Further, they did a qualitative analysis of free text answers, and the answers were, as you see here, seeking a second opinion, 31%. They mentioned because they need to seek a second opinion. And the next one was discontent with previous doctors and a wish for a primary evaluation of a medical problem. That's also nice. For example, sometimes it is necessary to consult to decide which specialist to see and evaluate how I am, to which specialist I should go. Another very important point they mentioned was asking embarrassing or sensitive questions. And they mentioned in face-to-face sometimes we can't speak about our sensitive problems. But in telenursing or televisit, I can easily ask my question. And the next one, seeking information on behalf of your relatives. For example, your mother, your father, or any old person you care, or your children, or your relatives that you must help and take care of their health. And the next one was, they mentioned preferring written communication. That's also amazing because written communication will provide you some material or contents that you always have access to them. And the last one was about people who are far away from regular services. They prefer telenursing services because in their area, they don't have access to such services. Now, again, I put here a table from inside the article, and we want to review it with another word. This table shows the results of quantitative analysis. You can see the first one is, it is convenient to ask a question and read the answer whenever it suits me. So it means when they can have access anywhere and at any time, it's appreciated. And also the second one is, I appreciate the opportunity to ask anonymously or unknown. It's again confirmed the answer which was about sensitive questions. Doctors are so busy that they don't have time to answer questions. Or maybe they mentioned the time doctors spend for a visit. It is difficult for me to find time to visit doctors. Now the patient says, I don't have time, or the doctor have not time. I can't find a time for visit. And it has been difficult to get an appointment at regular healthcare units. I feel uncomfortable when I see a doctor. I could not afford to see a doctor. And these were the first table. Now, the next table also we review again. And here are the results for the qualitative analysis. The first and highest answer they mentioned was for the second opinion. They sometimes need to see another doctor or nurse. And dissatisfaction with previous physicians calls for doctor change. And initial evaluation of a medical problem to see what they need to do, which specialist should they go to, where to go. And the other was convenience and distance and time. And again, embarrassing concerns and worries which they cannot speak about in face-to-face visit. And last but not least, the preference for written communication, as they can review it over and over again to improve their health and better care of themselves. Okay, next slide, slide 13. Another study on practitioner-patient communication in reproductive endocrinology and infertility practices showed the importance of telenursing for nurse-patient communication and examined participants' conceptualization of supportive and unsupportive communication, and examined and they mentioned patients' positive perceptions, and suggested for increasing patient access to telenursing while protecting nurses from burnout. In another article, health-related app is used for management of date and time, health records, consultations, reinforcement of self-monitoring, data collection, clinical decision-making, patient monitoring, education. And in this article, apps interventions are classified in 3 categories: monitoring, education, and reminders. Monitoring, for example, blood pressure, heart rate, blood sugar, step count, and about education, information on the disease, medications, diet, exercise, smoking cessation, weight control, and lifestyle patterns, and so on. And example for reminders for medication, for monitoring or lifestyle modification. And these reminders were sent via app, SMS, email, or phone call. Interventions in this article were via smartphone or tablet platform. And in conclusion, it is mentioned effective means to self-manage may be designed to provide educational content, promote long-term self-management, collected data to improve the accuracy of decision. Also, results showed significant change and provided medication reminders and inconsistent effects on self-management. Here you can see another example, which is about artificial intelligence in a smart nursing home. Artificial intelligence may be used in mobile applications, Internet of Things, AR, and VR, or augmented reality and virtual reality, big data, and smart nursing home. It may communicate nurses and clients by collecting, send, and receive data from sensors. Also monitoring physical and mental conditions of patients, simulation, technology-based learning, decision support system, automated alert system, care plan modification, modeling, forecast. And also meaningful use technology. And the last one, information stored and retrieved from dashboards. So the utilities of artificial intelligence in a nursing, smart nursing home be mentioned here. The other sample was a scoping review. Oh, sorry. First, I should talk about this article and conclude it. In conclusion, smart healthcare applications are commonly used in disease prevention, monitoring, diagnosis and treatment of health conditions, hospital management, health decision-making, and medical research. Therefore, in all these cases, they are also used as telenursing services, and nurses and also nursing service applicants welcome the use of these tools. Now we go to slide 17. Here we have a scoping review about IoT for basic nursing care. And innovations in this article were identified in several topics and categorized in 4 basic nursing care activities. As you see, periodical clinical assessment, comprehensive assessment, and activities of daily living and care management. About periodical clinical assessment category items were vital signs detection, neonatal monitoring, pain management, and medication. And items under comprehensive assessment activities for basic nursing care in this article were included topics of hygiene and comfort. And activities of daily living were included physical activity, fall detection, sleep, and secretion monitoring. And the last category was care management activities, included topics of decision-making, support, tracking personnel, patients, and devices, and nursing or nurse calling system. Some points were mentioned in this scoping review may be in value for nurses and clients who are interested to use telenursing services, and I found them amazing. For example, system security as an important subject in Internet of Things based systems is identified to preserve privacy and improve trust between patients and professionals. This was the point I mentioned in pre-test question. So preserve privacy improves trust between patients and professionals. Otherwise, if you see the utility of sending and receiving information, it cannot bring a trust. So the important point is privacy. And here IoT system prepared this opportunity. And the next one, automated tracking of patients and personnel along with fall detection and nurse calling systems give the organization new means of promoting patient safety. The next point was providing automated hand hygiene detection and reminders brings opportunities to the still unsolved and continuous struggle against the healthcare associated infections. So hand hygiene detection and automated hand hygiene detection can improve and can all be actually has a benefit to overcome or reduce the infections. The next one promotes patient safety by wireless solutions, How? By promoting a feeling comfort for all patients, particularly in cases of children and disoriented patients. Another value is the opportunity to include family in the care by offering real-time data remotely. For instance, patients would achieve an advantage in diagnosis and treatment procedures by enabling personalized decision-making approaches and subsequently minimizing mistakes. And the next slide, I want to talk about one experience I had with my colleagues. My colleagues and I did a telenursing study by sending text messages, which we briefly review here. We investigated the effect of a text messaging-based psychiatric nursing program on quality of life in veterans with PTSD symptoms. This is a free article and it is published in PubMed, so you can access and study it completely. The intervention group received psychiatric support via short text messages for 6 months, whereas the control group received the routine hospital care. A significant improvement in PTSD and quality of life was observed in the intervention group compared to the control group. And actually, the text messaging-based psychiatric nursing program reduced the severity of symptoms in veterans and also improved their quality of life. Now, I think only 2 slides are left. Don't worry, it is near iftar, I think. The contents of the text messaging program for PTSD self-care was designed based on an extensive research of available databases, validated literature, scientific resources, and comprehensive evaluation of psychiatric nursing texts used in military organizations for PTSD veterans, and Persian PTSD practice guideline from the Veterans Institute of Medicine. And they received daily messages for 6 months and via SMS. The contents of the messages were categorized as welcome message and program introduction, description of PTSD symptoms, methods of accepting and dealing with PTSD symptoms, self-control, relaxation and deep breathing skills, and anxiety management skills, recurrence prevention assistance, importance of treatment adherence, methods to deal with insomnia, methods to deal with intrusive thoughts, attitude change and positive thoughts, self-confidence and sense of value, and methods to deal with sleep disorders, methods to prevent suicidal thoughts, and importance of proper diet and environmental changes, also substance-related addiction, self-care, meditation, messages on special occasions, and then closing remarks messages. I want to read 2 of these messages for you. The feeling of anxiety can cause me no harm. This feeling will end soon. I can take control rather than let anxiety overtake me. At an appropriate time, sit or lie down, make yourself comfortable and relax. Close your eyes, breathe deeply and slowly, and relax your muscles. You can do it now. It's a nice message. Imagine that you can see the colors of the rainbow and everything feels fresh. As the participants requested, messages were sent at 6 p.m. And they were followed up by specialists per month. Okay. In this article, we found that in all 8 domains of quality of life, they improved, because the design of the proposed intervention in the present study was based on increasing patients' awareness and reminders to consider alternative treatment approaches. For example, psychoeducation, training exercises, muscle relaxation, breathing exercises, and non-medicinal therapies, mostly non-medicinal therapies. Now, I think reviewing these articles and also lectures of our distinguished lecturers, we can conclude that actually this society needs telenursing services. And because they need, we nurses need to study and prepare to provide safe and quality services. There are some telenursing guides published in different articles or resources. You may review some of them mentioned in the sessions and look at the references of Professor Hepta, Professor Sipes, and Dr. Rose lectures and our previous series of nursing informatics. Here I mention another reference that's a practice guideline for nurses telenursing revised to 2022 by the Nova Scotia College of Nursing, or NSCN. And as you see, the contents are included: telenursing, professional practice, and competencies, risk management, context of practice, cross jurisdictional and practice-informed consent, confidentiality, therapeutic nurse-client relationship, and documentation. I added the references to each slide, but I will complete the references for the end and give this slide for uploading to the website. Now, you can ask your questions, and I would like to know your opinion about why nurses and clients choose telenursing. And also, I would like to be aware of your experiences of telenursing. Thank you.
I really appreciate your endeavors and your great lecture, Dr. Asieh Darvish. Now it's time for question and answer around Dr. Darvish's lecture. If you are interested to speak, please raise your hand so we could activate your camera and the microphone. Otherwise, write your question in the chat box. Thank you. We're waiting for you.
Yes, I can see Wahab Osman.
Yes. Osman says, now in no previous studies cited, next to none came from Africa. It is a concern because nursing is still at basic level.
But I saw already an article and I had some students. I think there is articles for telenursing in Africa. And if you look at Web of Science and search telenursing there, you will see if from your country also, is there any article or not? And it's good you participate in this program, then you can share the knowledge with your friends and colleagues.
Any other questions? As I've said before, you could raise your hand to activate your microphone.
And also, I wish you all the best because we are actually in the end days of Ramadan, and please pray God for me also. Thank you.
Thank you all, dear audience. Now it's time to test what you've learned from today's lecture. So we will launch the poll and you can answer the post-lecture questions. Dr. Darvish, could you please launch the poll if you have access?
No, I think I don't have access, but I can see now in the last one, the poll which was in pre-test. Okay, so just a minute, post-test and launch. Okay, I can launch it.
Thank you.
I did it. Okay. So please, participants, do answer the questions. Thank you.
During making the poll and doing the poll, I have to mention that for those who didn't have a chance to register, the registration is still open on the website. You can access the registration form via the link we have provided in the chat box. Yes, and the link is in the chat box available, so you can register if you haven't done yet. %55% have done the poll. Thank you, and we're waiting for more. Thank you for staying with us. 62%. Thank you. %67% have done the poll. Thank you. Thank you very much. We're waiting for other participants to do the poll and then close it. 72%. Thank you all. Dr. Darvish, could you please close the poll? 76. It's rising.
Sorry, I stopped sharing and you can continue. Poll is over.
Thank you. Thank you all for staying with us. Thanks to Professor Sipes and Dr. Asieh Darvish. At the end of today's meeting, kindly, I would like to ask everyone to turn on their cameras so we can take a group photo, actually a virtual group photo. I repeat it in that time. I kindly ask you to open your cameras so we could take a virtual group photo. Now we have Dr. Sipes and others. Dr. Tony Hepta.
I think Mrs. Sadeghi in our Appraise to Raise team has taken the photos. You can mention next session and end the session. Thank you so much. Thank you all participants, and especially thank you Professor Sipes, Professor Hepta, and Dr. Rose. Thank you.
Thanks to all of you. Thanks to the professors from different countries. And we'll see you next session on the next Saturday. So stay with us.
Thank you. Bye.
Bye-bye.
Bye-bye.